Good afternoon, everyone following us. My name is Sarah Hasna Motadem. I'm an international relations specialist at the Policy Center for the New South. We are pleased and delighted to welcome you today to this discussion organized in partnership with the Institute for Security Studies in Addis Ababa on Africa's response to the COVID-19 outbreak. The coronavirus disease was first detected in December 2019, following the occurrence of cases in Wuhan, China. Since then, the disease has now been reported in almost every country, according to the World Health Organization, and as of today, May 21st, 5 million persons infected globally, including over 320,000 persons losing their lives after contracting this virus. No one was really prepared for this epidemic, not even the most advanced economies. So as the virus was rapidly propagating globally, many have signaled the extreme urgency facing our continent and the potential for COVID-19 virus to spread in countries with much weaker health systems. So whilst dealing with the health risk, countries are now also faced with the consequences of the global disruptions induced by the global pandemic crisis. We are here to discuss and assess the responses to the COVID-19 outbreak in Africa at regional and continental levels. We will talk about the continent's responses as well as the opportunities that may arise for better prospects towards African peace and stability, as well as economic integration and prosperity. Without further ado, let me introduce you to our distinguished speakers. Dr. Andrews Atta-Samoa, Senior Research Fellow, working on the African Peace and Security Dialogue Project at the ISS Addis Ababa office. Before taking up his position, he has also worked at the Kofi Annan International Peacekeeping Training Center in Accra, and was also a member of the UN panel of experts on South Sudan. Dr. Paul Simon Hanley, Senior Advisor to the ISS Regional Office in Dakar and in Addis Ababa. He first joined the ISS in 2007 and held various research and management positions. Between 2013 and 2018, he was on the UN panel of experts on the Central African Republic before rejoining the ISS in 2019. Ambassador Mohamed Lulishki, Senior Fellow at the Policy Center for the New South, where he focuses on diplomacy, conflict resolution, and human rights. He assumed different functions and represented Morocco on a diplomatic level. He was also a member of Ambassador of Morocco in Hungary, Bosnia, and Croatia, Ambassador Coordinator of Government of Morocco with the MINURSO, Ambassador of Morocco to the United Nations in Geneva between 2006 and 2008, and in New York 2001 to 2003, and between 2008 and 2014. Ambassador Lulishki was also appointed President of the Counterterrorism Committee of the Security Council in 2013, President of the Working Group on Peacekeeping Operations in 2012, Vice President of the Human Rights Council, and President of the National Committee in charge of the follow-up on nuclear matters. And last but not least, Professor Mostafa Razrazi is a Senior Fellow at the Policy Center for the New South, where he focuses on Afro-Asian affairs, strategic and security studies, terrorism, extremism, and de-radicalization, mainly from the view of criminal, legal, and forensic psychology. Professor Razrazi is a professor of crisis management in Japan and has other professional backgrounds as doctor and practitioner as a clinical psychologist. So thank you, esteemed gentlemen, for joining us today. Since the pandemic started, the characteristics of the virus and pace of the epidemic globally made it inevitable that the disease could spread very rapidly on the continent. Most countries have focused on protecting their nationals. However, it is clear that fighting the pandemic goes beyond one's borders. It will not be effective to combat it only within national borders, as this pandemic, by its nature, is very global. In early February 2020, while there were still no confirmed cases of COVID-19 infections in Africa, the Africa Center for Disease Control and Prevention, the Africa CDC, established the Africa Task Force for Novel Coronavirus to oversee preparedness and response to the global epidemic of the 2019 novel coronavirus disease. Dr. Atta Samoa, how did the African Union and specialized technical agencies address the pandemic threat in the continent? And what are the mechanisms put in place to strengthen response capacity on the continent?
Thank you very much, Chair, for this very important question. I want to wrap my thoughts around two levels. One is how the AU has dealt with it at a technical level. And secondly, to look at it how the AU is supporting the technical efforts through diplomatic efforts around those. If you look at the AU's technical efforts, as you indicated in your introduction, the Africa CDC is primarily the entry point for all the efforts the AU has rolled out since about February, even before the first case of the pandemic was registered on the continent. And what we've seen is that the Africa CDC's role has largely been around three very important points. First is that they've been really important in terms of information sharing. As you indicated, the establishment of the Africa Task Force for the pandemic has been very crucial in terms of bringing some level of technical and scientific legitimacy to the continental response. So the Africa CDC has been a crucial source of legitimate information regarding COVID. It's also been, and if you check their website, they've been religiously providing regular updates, compiling exactly what is happening, and deducing what the spread is on a weekly basis, as well as on a daily basis, as well as the fatality levels, which gives us a very true picture of what the situation is. I think that given the extent to which misinformation has characterized the spread of COVID, having a platform at a continental level to be able to get the right information has been very important, and also at the national level in terms of guiding national efforts. The Africa CDC has also been very crucial in directly contributing to equipping member states. So far, I think about 48 countries have received various forms of equipment from the Africa CDC. And also, they've also been, in very many ways, involved in capacity building around various emerging thematics around the response to COVID. And so what you see is that they've had series of trainings at the national levels around best practices in handling COVID, around testing, best practices in testing, and also how to sustain essential healthcare as part of the response to the COVID pandemic. And that second aspect has also brought, really, he has influenced the extent to which the continent has been able to mobilize at the national levels to addressing the pandemic. And most importantly, the CDC has also been coordinating Africa's response, first of all, to source the kind of equipment that are needed in responding to the pandemic. And if you realize, at this particular time, a lot of the equipment that are needed at the forefront of the pandemic are actually in short supply. So countries in Africa that struggle with bulk purchases will struggle to be able to compete with the big ones. And so pooling the procurement resources together, as the Africa CDC is doing, has helped hugely to even equip those that will not be able to put forward very massive amounts towards procurement. And in doing that, we've also seen that they've also coordinated partnerships to support the tracking, the testing, and in some cases also the tracing of cases. And they are trying to push for close to 1 million testing. And as of their last briefing, the indications were that they've been able to distribute close to more than 900,000 testing kits on the continent. So at a very technical level, you see the CDC playing a huge role, even though the CDC practically is just about 3 years old since it was established. So if you look at what the CDC has done at a technical level, you can conclude that first, the AU has been able to bring some level of continental legitimacy to the whole fight against the pandemic, but they've also, in a way, provided a room for the CDC to position itself as a very important establishment going forward, even towards the aspirations of Agenda 2063. And I think all of these have attracted a huge funding going forward. Now, on the diplomatic level, we also see at least two very important mobilizations that the AU has done. At the level of efforts to quickly raise funds that could sustain continental efforts, we saw right from March coming through to this time, we've seen increased efforts to mobilize funds, both domestically and externally, so as to support ongoing efforts on the continent. And that is seen through the establishment of the anti-COVID, Continental Anti-COVID-19 Fund, which happened in March. And we saw very early in March that the members of the Africa Union Bureau themselves were able to agree to contribute about $12.5 million in that section. I think part of that is substantially supposed to go towards the efforts of the Africa CDC. And for a continent that largely usually struggle with financial issues, I think this may sound small, but it's a very significant step that the AU was able to do. From where I sit, the rapid nature in mobilizing the response and even thinking ahead to coordinate fundraising in that direction is in itself very important for an AU that struggles with a lot of challenges on this continent. But at the diplomatic level, we also see that the AU has been able, first of all, to start thinking beyond the crisis itself. And if you look at the appointment of the 4 envoys who are supposed to champion the mobilization of support for Africa's efforts to address the economic impact of COVID, you get a sense that the AU is not only championing the response at a continental level, but they've started thinking, but also appreciating the fact that when all of this is over, the economies are good, there's going to be a knock-on effect on African economies. And so there's the need to start thinking about debt relief. There's a need to start thinking about how to support member states to address that economic aspect of the COVID pandemic, which I think if you put all of these together for an AU that is largely a diplomatic framework or a diplomatic theater for African engagement, I think that is the AU has provided a very important role in shielding, but also mobilizing and providing the framework with which the continent is able to respond. I mean, there's the need to appreciate the fact that a lot of the response are happening at the national levels primarily. But that said, the continental efforts are providing a framework for support, but also a framework for coordinating exchange of information, but also coordinating Africa's engagement with other parts of the world, which is necessary at this particular point where global leadership itself is struggling in the midst of this pandemic. So that is how I would like to capture the AU's response so far in terms of dealing with the COVID pandemic.
Dr. Eldrazi, in early February, the first confirmed cases of the novel coronavirus in the continent were reported in North Africa. Since then, the region is the most affected by the virus in the continent. So what were the responses of the COVID-19 outbreak in the Maghreb region, and has there been a unified approach so far?
Well, thank you very much. I guess it is true that North Africa has been the first, region in the continent that manifested contamination. It was almost at the first week of March, the 2nd of March, if I remember. Then, but this has to do, I guess, with another criteria, which is the connectivity. I guess that the positioning of North Africa, mainly Morocco, Tunisia, Algeria, are much more, close to Europe. There is a human mobility, there is a traffic mobility, and some other aspects of connectivity that brings, of course, and with the huge number of Maghrebi diaspora in Europe, all these elements make, I mean, the continent, the region quite exposed, and the first warning area, if you wish. Today, before we go to see how these countries, and we cannot talk about the region because in my sense, I mean, there is some similarities, but there is some divergence. But there was no, in my understanding, there was no joint or unified approach to deal with the pandemic or the propagation. So today we have some numbers, we accumulated numbers that can help us to assess somehow the responses. Look into Morocco, for instance, we are around 7,000 cases. We recovered almost, they reach 58. The number of tests is around 110,000 or 11,000 cases. So comparing to Tunisia, for instance, which was taking the lead in terms of tests, we can see that Morocco and Tunisia are much more or better, how we say, assessed or qualified to be assessed even by the World Health Organization as countries who are controlling almost, or they are close to control the pandemic. If we go to Algeria, for instance, Algeria, I mean, in terms of number, by the way, I mean, there is no differences comparing between Morocco and Algeria. It's almost some 100 differences in terms of contamination. But if you go to the number of deaths, it seems that Algeria is taking the lead in the continent, in the region, with more than 500, I mean, cases, death cases. But the problem is around the tests. So it seems to be even, I mean, if you go to the statistics of the World Health Organization, it seems that they are not that much convicted by the number provided by public authorities from Algeria, since they believe that it is under the estimation to see if they are controlling or if they are monitoring the virus or not. But there is some numbers that can help also, not only for the region, some numbers that can help us to debate or to brainstorm some issues related to the age, for instance. So many narratives coming out, not only from abroad, but even from our continent, talking about that the continent is young, and this is a very prestigious indicator that can help us. But if you look, for instance, to the statistics in Algeria, contaminated person who have less than 14 years old, they are almost 192. From 15 to 24, almost 322 with one death. From 25 to 49, and this is very important, we have 3,083 contaminated, almost more than 50% of the contaminated, with 48 deaths. And of course, the big number is those who have more than 60 years old. I mean, the number of deaths is 428 from 2,350. So I guess that there is some elements that can help us not only to look at the region, but also to use this performance in that part of the continent to brainstorm other cases in other countries or in other regions. Basically, the performance of responses of these countries, as I said at the beginning, was country or national based, but there is a lot of similarities. So it was an issue of connectivity, so shutting down all the connectivities, closing airports, schools, religious space, workplaces, providing or promoting social distancing, increasing media awareness, and at the end, I mean, how we say, implementing state of emergency. The only, and of course, some procedures like the mask, but there was a very significant element that we can see within those countries, that the time or the proactivity process was completely different. So if we compare Tunisia, Morocco in terms of procedure or imposing masks, comparing to Algeria, for instance, we can find that almost there is 30 days of difference between those countries. So if Morocco was at early April, Tunisia also. So I guess that only 19 May, Algeria has proceeded to impose masks. So unfortunately, these elements are not helping to conclude a joint, how we say, a joint process to, or joint, I mean, agenda, or joint task force even. I mean, yes, my colleague was talking about CDC, but I guess, unfortunately, I mean, the region, in the North African region, is not that much, I'm not sure, maybe I'm wrong, is not that much connected to that mechanism. It seems to be that that mechanism, despite of the fact that it is, how we say, monitored by African Union, it is much more focusing on some other parts of Africa. At least I'm talking as not only as a researcher, but as a citizen. I mean, when I'm looking to the news, I feel that there is a little bit a gap that we should review within our continental integration and joint awareness. Some other elements that I would like to share is, this is not the only criteria. Of course, if we are looking to different procedures that has been done, there is three types in my understanding. There is some technical, medical, pure medically, how we say, procedures to prepare, I mean, beds, to prepare hospitals, to prepare, I mean, tests, to prepare modalities of following contaminated persons. And of course, there is second line, which is basically in focusing on education, how to preserve the continuity of education by distance. And let's say that mainly I mean, Morocco, Algeria, Tunisia were performing well. And of course, there is the other line is to call for solidarity and to prepare some scenarios to project, how we say, the economic impact that will affect basically not only the economy, but the daily life of people. So there was some procedures. We can say that the first response in that sense was in Morocco, because I mean, there was a solidarity fund, which was not only, how we say, depending to the injection of money from the state, but also from private sector, from individuals. And it was not only focusing on money. Solidarity was extended to other sectors, including private hospitals, some experts who were engaged in public debates, and also private doctors who were working, and psychologists, for instance, who were working to follow up and to make a psychological company of the whole population, which is in lockdown. So, but the third element in my analysis is somehow related to the indicators of performance. At least, I mean, in crisis management, we relate to 4 elements that we usually use to assess if a performance is done adequately or not. The first one is the legal framework. So any decision, despite of the technicity of those teams, I mean, we need always to maintain a good governance. We need the legal framework. So so we can assess to what extent all countries have respected, such legal framework or not, which means those decisions, including emergency, if it was legally based, it was consulted with legislative instruments or not. So the second one is the transparency. And the transparency seems to be very important in 3 levels. Transparency between this crisis team and the population by providing them the epidemic situation on daily base, for instance, or weekly base. So we can find it different in North Africa. For instance, Morocco is almost a daily base. Some other countries, it's a weekly base, but also transparency with the international community to provide them with the statistics, with the data, with the evolution, with the measures taken, just to let them, updated, because the impact cannot be nationally assessed. So it can affect other countries. That's why the World Health Organization requires at least such mechanism. We have a problem with the World Health Organization because North Africa is divided into two regions. We have the Eastern Mediterranean region, and we have, another African region. So at least you can find Morocco with Tunisia, but also in another region you will find Algeria with Libya and Mauritania. And this is not helping even in the debates or within experts of WHO, because one region, but the conception is divided between 2 teams. So the other element in the assessment is the projection. So we can see to what extent those countries are working on the post-crisis, or at least what we used to call it the Circle 5-4-5. Because if we consider the Circle 5 is the circle of rehabilitation, the most difficult circle is 4, which is the period that all these countries will be affected, will get the direct effect of what has happened during the last 3 or 4 months. So here we can see that the accumulated economic performance also is affected. I'm not talking about technical issue, but the doctrinal issue. For instance, if you take Morocco, which is interdependence-oriented economy, yes, it has some negative aspects, but basically the connectivity with international funds, with international or financial organization is quite easy. With Algeria, which has never been believing in its economical doctrinal assets to debts or to international funding institutions, it seems to be that they have some difficulties even to debate it and to brainstorm it with the public opinion. We have one case which is quite critical is the Libyan case. The Libyan case, it seems that the virus combined with the conflict, combined with the 2 leading parts, despite of the fact that Tripoli is the much more granted, legal authority, but it seems even the World Health Organization, which is under the obligation to communicate with everybody, because it's the life of people, and they deal with the issue with a political approach, which is quite good, because we cannot ignore the Libyan people who are in the eastern part. So, but this is affecting the data we are collecting also. So unfortunately, all the data coming from Libya, it seems to be true, but it is not, nationally approved. So it is not covering the whole country. We cannot use it to implement a national approach to deal, and that's why the conflict seems to be affecting too much this country. For Mauritania, so of course the number of contaminated people is limited, but we have the feeling also, if you would like to make an assessment, that the authorities are doing hard to control the situation. But for Mauritania, there is two elements. So it is a less connected country comparing with other, countries of the region. And also the cultural and the religious resilience is also very pressing on. And some people even interpret the fact that they are resuming or they are lifting, some strict measures is culturally based. It's not technically based. But I guess that it seems to be, at least if we believe the official statements, it seems that Mauritanian authorities, with the number they do have, they are still controlling the situation. So, well, I will stop here. Maybe in the second part, we can talk about challenges.
Thank you, Professor Zrazi, for this overview of how countries have managed the crisis at a national level in the Maghreb region. Dr. Hamdy, the CDC, the Africa CDC, is the key institution mandated by the AU to prevent the propagation of pandemic, and it was established as a response to the Ebola crisis. So the devastating Ebola epidemic in West Africa took 11,000 lives. It slowed down economic growth and closed down businesses, affecting the means of making a living of millions of the poorest and the most vulnerable people in some of the region. It also put pressure on government budgets, limited their capacity to provide basic services to their population. Did this unfortunate experience prompt changes in the way West African countries responded to the outbreak of the COVID-19 virus? And how did it reflect in the country's management of the current pandemic?
Thank you very much, Chair. I think to answer your question, the easy way out is to say yes, definitely the experience gathered during the epidemics, the outbreaks of Ebola and HIV probably helped a lot West African governments in framing the responses to the current crisis. And you should situate West Africa's response at two levels, where the first one is, of course, the regional level, which was mostly driven by ECOWAS, the Economic Community of West African States, and of course, the national level, where government took national measures. At the level of ECOWAS, I think it's quite impressive the way ECOWAS, on the 14th of February 2020, before even the first case was identified in West Africa, ministers of health actually held the first meeting regarding the regional management of the crisis, which is quite important because at that time there was no recorded case of COVID-19 in West Africa at all. And following this, there were a series of other meetings, even organized at the head of state level, now in Visio conference. So definitely, ECOWAS is among the regional economic communities that actually came up strongly and was even the first regional economic community to issue a regional strategy against COVID-19. Other regs followed suit. Now at the national level, of course, there were lots of measures that were taken, starting with actually airport control. And it was interesting to see that African countries, not just West African countries, but mostly African countries started taking measures, practical measures against COVID before the outbreak of the pandemic on the continent, which was in stark contrast with what we could see in European countries, actually. Up to early March, while the pandemic was actually unfolding in Europe, European airports were actually, no one could actually see any sign of serious controls at European airports, which was completely different in many African countries and particularly West African countries. So measures were taken. But Madam Chair, I would like to go beyond just the main, talking about the measures that were taken. I would like to also look at what drives government measures, what drives government responses. Because among the few things we know about the virus is actually that we know very little about it. There is a dearth of knowledge about the virus and its various manifestations, not just in Africa, worldwide. That makes it, of course, extremely difficult for government to base their responses on solid evidence. So we see at the one hand, some responses that are very similar in countries, I mean, indicating a level of mimetism, but also some countries making the efforts of adapting measures to their national context. But we also see that the different ways in which countries manage an epidemic, meaning the number of individuals and the ways people that are diagnosed or not, the number of people treated, and also the death rates. All those issues are not only interesting indicators of the health systems of countries, but also of other spheres of governance. For example, the nature and efficiency of bureaucracy, the specifics of political decision-making, actually. So experience drawn from the fight against Ebola and HIV/AIDS in West Africa can be useful in understanding what drives government responses in West Africa. And the famous phrase, know your epidemic, act on its politics, emerged actually from the political economy of the fight against HIV/AIDS and Ebola. So in a context of widespread ignorance about the nature of the virus, what are the facts that drive government responses to COVID-19? So every national context is different. Responses should actually follow national and even provincial specificities. But instead of these, as I was just saying, we see a lot of mimetism, a flurry of standardized responses, and very little innovation, except for some countries and some instances. But we can already observe that whereas government measures have an impact on the various national contexts, those national contexts also influence the nature of governments. And I would like to illustrate it with two examples of measures. The first one is the restrictions to mobility. So that many governments have imposed on their population. And with that, I mean the curfews, the isolation of urban centers that are considered as epicenters of the pandemic, the ban or restriction of public transport, mostly in urban areas. While it is important to note those measures, it's also important to note the responses or how the popular responses to those measures. In a country like Senegal, for example, initial measures announced by government have globally been very well welcomed in major urban centers. Before issuing the measures, government widely consulted with important socio-political groups like political parties, religious authorities, and private sector. Paradoxically, the fragile consensus that was reached for the initial measures was broken when government recently eased out the initial restrictions without consulting in the same manner as it did previously. So particularly religious leaders were not happy that measures were actually lifted because they were not prepared. In neighboring Mali, another example, restrictions related to the curfew were strongly contested by the population. We have to say that Mali is going through a deep crisis, which sees government decisions generally contested by an aggrieved population. The COVID-19 pandemic has just added another layer of complication to an already tense context of social relations. So, and in order to ease those social tensions, government decided to keep places of worship open, which really appears like a contradiction. And finally, in a country like Cameroon, politics has prevented wide social consensus in the fight against the pandemics. Government's distrust by the population prevented a thorough implementation of restrictive measures, which caused an explosion of cases. So in this context, the softening of these measures, as recently done by government, suggests that economic and fiscal factors played an important role in driving government's decisions. So some observations we can make out of it are that many restrictive measures were unfortunately not always accompanied by the necessarily wide range of actions that would have been helpful in getting a better grasp of the prevalence of the pandemic. For example, very few countries of the region have used the lockdowns or partial lockdowns to test massively. I mean, for reasons we can understand, but in so doing, they have wasted an important window of opportunity to gather important data that could have been used in making future policies. Another example I would like to take to illustrate what drives government's responses to the pandemic, and it revolves around elections. We've seen a set of elections taking place in West Africa recently, and in many cases, those planned elections were already considered as potentially risky, regardless of the pandemic, which only added another layer of complication. A common denominator of these elections that have taken place so far in countries of the region is the lack of political consensus, aggravated by popular perceptions of the lack of proper voters' protection in polling stations. So those fears of the population of not being protected partly explain the very low turnout in most elections, a factor that could not be observed recently, for example, in a country like South Korea, where voters' turnout was particularly high despite the pandemic. So in Guinea, we can see that example, but also in a country like Mali, where the double threat of terrorist attacks and the pandemic contributed to keep voters away from polling stations. According to official figures, only about a third of registered voters turned out in polling stations. So what can we make from this? There are a couple of observations we can make. I'll probably come back to them later, but we can see that health considerations alone do not play the most important role in responding to a pandemic, at least in West Africa, as we can observe it. Politics, and sometimes even ideology, albeit not necessarily in the region concerned here, as well as socio-economic consideration, security factors are important variables in understanding policy making during a pandemic. Corruption, or even perception of corruption, is also can be an important lens through which responses can be analyzed. So moving forward, then we know that those responses need to be built on strong evidence. But we will certainly come back, I'll certainly come back to it later on when we address the challenges related to those responses. Thank you, Jim.
Thank you, Dr. Hamdi. For sure, the magnitude of the crisis globally has become clearer with every day passing. It could have important impacts on peace and security, development, human rights, but above all on the lives of and livelihood of ordinary people, and especially the most vulnerable. Since the announcement of the first cases in Africa, the United Nations and the World Health Organization officials have sounded the alarm over the critical situation in which Africa finds itself in face of the dramatic humanitarian challenge, and called on the international community to help the continent to limit the impact of the virus on the African population, especially refugees and displaced persons, the vast majority of whom are settled in African countries. Ambassador Lulishki, the current crisis is challenging the humanitarian community in areas where humanitarian responses are already stretched. Movement restrictions imposed to keep the disease at bay, including social distancing and isolation measures, remain challenging and almost impossible for many IDPs, which heightens the risk for COVID-19 to take root and spread rapidly in the continent. What are the measures put in place to protect these vulnerable people in the continent? Ambassador Lulishki, I would kindly ask you to unmute yourself. Thank you.
Maybe before addressing the issue of the responses, let me first of all congratulate both ISS and PCNS for making the south of Africa meet the north, even if only virtually. I hope that this event will be followed by another one where we can maybe take stock of what has been achieved in terms of exit strategy by different African countries, and maybe draw some lessons from the respective experiences of African countries. Secondly, let me maybe just underline the moment in which this virus occurred and surfaced in Africa. It erupted at a moment when Africa prospects were promising for economic growth going from 2.9 in 2019 to 3.2 in 2020 and to a prospect of 3.5% in 2021. The 2020 after the COVID, according to the World Bank and other institutions, is about 1.8, unfortunately. The second element I would like to underline is the fact that Africa, before the COVID-19, achieved important gains in terms of poverty reduction and health indicators. And finally, Africans decided to implement the zone of the free trade zone, which is a promising project to make intra-African trade go up 25% by 2040. Well, all these very promising prospects seems to be now overshadowed by by COVID-19. Now, as far as responses to are concerned, I will begin by saying that Africa benefited from some comparative advantages that I will list in a very brief manner. First, the climate. Secondly, the low density of population, 4.3% by square kilometers compared to 181 in Europe and 154 in Asia. Africa benefited from European lessons and American lessons and Asian lessons. Africa also benefited from Ebola and HIV management by Africa. And it was extremely easy for African countries to mobilize again the networked communities that manage Ebola and HIV. Another element, which is the fact that Africa was extremely inventive in terms of creating some drugs, like, for example, Madagascar, that was adopted by at least 2 or 3 countries. And the young population of Africa also was extremely inventive in terms of providing masks, manufacturing masks and manufacturing other equipment that is necessary to combat this virus. One asset which is extremely important in terms of responses is this kind of implicit complementarity between the state and civil society and the private sector. I think this is the first time that all of us, regardless of our age, our color, our level of wealth, all of us were extremely anguished and fearful of dying from this virus. And I think this created some kind of chemistry between the state and the civil society. Civil society showed citizenship, showed acquiescence to the very robust decisions that were taken by the. And this comes, of course, by some benefit dealing with COVID-19, but at the same time, it comes with some expectations from the civil society. Civil society, and particularly the most vulnerable among them, were expecting from the state, because it shuts down most of the economic activity, tourism, and other economic activity. They were expecting from the state to provide a minimum wage for the most vulnerable who do not have any alternative. So, and to do that, I think that the authorities dispatched a very professional way of communicating, of using physicians, of using experts in medicine, experts in epidemiology, in order to educate the population and in order to see the population adhering to the measures that were taken by the state. So this has as a consequences, as I did, a consolidation of the relations between the state and the society. Young Africans also were extremely inventive, as I mentioned, in terms of helping the state coping with the challenges of COVID-19. And I think that in terms of education, in terms of healthcare, Africa maybe will continue to bridge the gap between Africa and the other countries in terms of using new technology for information and communication. I would like personally to really believe, and I earnestly believe, in a resilience by Africa to this COVID-19. I would like you to register what I'm saying, that I think that Africa will be modestly successful in dealing with COVID, but the problem is that Africa will be suffering from the consequences of COVID-19 in terms of maybe exacerbations of the humanitarian situations because of the climate change, because of the floods, because of the change of pastoral customs and habits between African countries. I do not subscribe to the word like tsunami or like catastrophe, but I believe that with the determination of governments from Africa, but also with the international assistance, Africa can manage to exit this pandemic with the least consequences and the least damage.
Thank you, Ambassador. Definitely this crisis comes at a very critical time. As you said, it's not only jeopardizing the continent's hard-won developmental and economic gains, but the induced global disruption on the supply chain and trade will have a dramatic impact on the continent as well. And this leads me to my question to you, Dr. Asamoah. Did the current crisis reinforce the necessity of having a continental free trade agreement?
Come again, please. I lost you for a second.
Oh, I'm asking you whether, given the global disruption on the economy and the way it might impact African economies in turn and jeopardize their growth and their developmental gains, do you think the current crisis does reinforce the necessity of having a continental free trade agreement?
Thank you very much. I heard you this time. I think the simple answer is yes. And if you look closely, one of the most important lessons from this COVID pandemic globally is the realization that, first of all, whatever happens in Wuhan or any part of the world connects to everybody else anywhere. And so the context within which we live is more connected than we think. Second also is the fact that relying on only China and some limited sources for inputs into the global supply chain concerning very crucial items, particularly in dealing with pandemics and other sensitive peace and security matters, is a risk in itself. And so what that means is that going forward, we are going to see countries beginning to have a second thought about the kind of how to increase the, particularly in Africa, our input and contribution to the global supply chain. And I think that is where now beginning to look within Africa and take advantage of the existing comparative advantages in manufacturing is going to be hugely important. And luckily, that is the kind of context and mindset we need for the continental free trade area to take off. Because we may be having some successes at this point, but we are not too sure. And I don't believe this might be the last we would deal with. There might be other ones to come. And so it's important for countries, particularly as African young people are innovating, to start looking within to see what is it that we can capitalize on and support and build the necessary local industrial capacity to be able to respond to such emergencies when it comes. Because globally, we see that even the most powerful are struggling to have enough equipment. And when it comes to a situation where you have a competition, then the smaller ones are clouded out in terms of bidding for the right equipment and all that. So it's important, and this is a kind of context that Africa needs, is a kind of shock that Africa has always needed to be able to take seriously its commitment to some of these things. The other point I want to add, which is not directly connected to the trade question, is actually about, first of all, acknowledging that we've registered some successes. All the projections that were made in the early days of this pandemic about Africa We seem to have succeeded from all the indications that my colleagues spoke about, West Africa, North Africa, and Ambassador's input. What we realize is that we've been able so far, and cautiously, to slow down the spread. My sense is that it is very early for anyone, for countries to think we've been able to successfully manage this pandemic. And I'm saying that purely on the basis of how fast this pandemic spreads, the COVID-19. And in early May, the president of Ghana gave an example of a situation in the city called Tema, where one person was able to infect more than 500 others in the factory. Now, the worry, and which I think is a very important conversation in this context, is that economic issues, the reality of the livelihood question in the various states across Africa, is forcing many countries to reconsider the strict measures they've already rolled out. Now, what that means is that the lifting of all these restrictions is going to provide a context for the situation to change quickly. So rather than, so what we've seen so far then is that going forward, we've gotten to a very crucial point in the fight against this pandemic, because the story can change rather quickly. Because the successes we've seen so far in terms of the slowdown of the pandemic are as a result of the restrictions, but also social distancing. Now, once all of these are lifted, and if they are not done cautiously, the curve can change rather quickly, and then we will be back to where we do not want to be. So Africa is not out of the woods at all at this particular point. I don't know whether I should use that as a segue to get into the challenges question. Okay. Now, one of the things to highlight, and it's important, if you look at the briefings that Africa CDC has been doing, and or if you compile your own figures in terms of the trend of rise of the epidemic in Africa. So far, it looks as if, as of today, we are in the range of 3,000 infections per day. Now, the challenge is that you first have to contain the rise or keep it stable before you can even drive it down. Even if it remains as it is, per all the strict measures we've rolled out so far, what that means is that 3,000 per day is still too high. And so efforts will have to be doubled. And I'm concerned about the rise of numbers in particularly poor contexts where we do not have any kind of health infrastructure, such as South Sudan and other places, because that is where we will really be tested in terms of our resilience. Now, at the continental level, one of the key challenges we see is actually what the other speaker highlighted, the fact that sometimes some of the efforts at the continental level are not necessarily evidently connected to the efforts at the grassroots level. And if at all, it has to go through the regional to the national, at which point the relevance of institutions like the AU begin to disappear. And so you have an AU that is struggling to push an agenda, yet at some levels, their presence is not really felt. And that is very important. It's important that, and that is a challenge, because you can do all you want unless you connect to the grassroots and get national buy-in to do that. Then your relevance is really very questionable in very many aspects. Second is that Africa, even though we have national lockdowns, you cannot freeze other threats and challenges Africa deals with. And so the terrorism question is still there. The conflict situations are still there. These have not been frozen to any extent by the fact that there are national lockdowns. And so at the continental level, we've had to juggle serious issues and prioritize all of these in the context of limited mobility and in the context of limited financing, and also in the context of limited ability to project relevance in all these areas. That has, from where I sit, that has divided the kind of attention continental and regional institutions could have rolled out if if, for instance, the pandemic was the only thing they were dealing with. Going forward, we need to figure out how that can be done. Third is also the existence of outliers who, in the name of their own understanding of this pandemic, are in a particular bubble of denialism. And so it is not every country that is responding to the situation in a strict way as needed. What will happen then is that even if you deal with yours in your country and later open the borders, you will still be able to inherit infections coming from elsewhere, which means that our inability to isolate situations and finish them is actually a problem. Our connectivity going forward makes all of us vulnerable equally. And so it raises questions about the extent to which some of the efforts are not regionally coordinated, but that a lot of them are also nationally centered, because it raises very fundamental questions. But also the questions about, if you take an African country and they need, to institute strict efforts, you still have to juggle with the number of things. The public health question is there, the security question is there, the livelihood question is there, but also social cohesion. And many countries are struggling around this. And these have important consequences at the national level, as Paul highlighted. But these also are influencing regional effort as well as the continental, which raises a lot of questions that in all of these, the little the AU has been able to do highlights two things. Number one is how the impact of strong institutions in Africa, if we can have institutions like CDC and properly equip them, the CDC exemplifies how robustly we'll be able to record successes in very many areas. Second also is that we've seen very strong mobilization leadership from the chairperson of the AU. We've seen Cyril Ramaphosa, at least as a chair, mobilizing African leadership in a way that they have conversation around this particular existential threat. And that also, in a way, highlights the fact that the AU has always registered some successes when they have strong lead states. I think that we can unpack later, but that is how I can see it. Whenever the AU struggles, it's because AU's strong member states have refused to take on board particular agenda. In this case, because of the nature of the threat, we are seeing some mobilization. And South Africa's leadership, together with all the other countries, strong ones, are making an impact in this particular case, at least at the level of the continental mobilization. Let me end it here. I hope I'll be able to come back later. Over to you, Sarah.
Thank you. I mean, of course, national efforts are very important to foster any regional initiative or continental approach to crisis management. That's why I would like to ask you, Professor Rizrazi and Dr. Handy, from the experiences either in West Africa or the Maghreb region, how do you think national policies and national measures have challenged or either challenged or facilitated regional approaches? And if there was no regional approach, do you think that this could serve as an experience for better management in the future and open different prospects for better coordination and better initiatives, joint initiatives? Dr. Handy, I'll start with you.
Thank you, Madam Chair. I think West Africa is one of the regions where we really had a certain level of synergy between the regional and the national levels, because the region has a history of doing that. But of course, the onus of the measures has been on the national at the national level, of course. One concern I have, actually, despite the fact that reactions have been relatively to the level of the threat, but we've seen so many variations in national responses, which of course also leads to will lead to to very heterogeneous levels of successes or failures. And I'm just wondering, how will it look the day after, if ever there's a day after? How will it look like? We'll have countries that have performed relatively well in containing the spread of the virus. And we also have on the other side, sometimes at their borders, other countries that have performed much lesser well. And the question I'm just asking, and I'm really wondering about that, will the borders be reopened between those countries? I mean, for countries that are connected by air, there are some levels of control that can be performed. But I'm just wondering, and this is also related to your earlier question about the free trade area, I'm just wondering, are we just going to reopen the borders knowing, with one country knowing that the neighboring country was not as stringent in taking measures, and then just opening particularly roads back to the stage we were before the crisis? This will certainly have an impact on trust between countries, and this lack of trust might also affect the way countries trade with each other. We already see in certain countries, particularly in Central Africa, between Cameroon and the Central African Republic, we've seen already a level of unease between the two countries, because as a landlocked country, the Central African Republic is actually has to open its borders with Cameroon, a country that has a very high level of infections, and it has already brought some levels of disputes between the two countries. We've also seen and Zambia in Southern Africa. So I'm just wondering how these different levels of successes and failures might affect trust in reopening the borders the day after the pandemic.
Thank you. I also take the opportunity to open the floor for questions, as we do have people following us on YouTube and Facebook, and they've started asking questions. So I'd like to add one to your discussion, Dr. Rizrazi. If you could also respond to this one, as it does relate to the second point you have made as a priority, which is transparency. And there is a question also from the public saying that without more comprehensive and timely data, we will not be able to ascertain the full social and economic implications of this crisis, particularly for the most vulnerable. There are now many COVID-19 dashboards and too many big data projects in Africa, but the usefulness of these tools depends on the availability of data. Isn't it directing to reflect to states on good governance? Isn't it probably a fortunate step to recall for more transparency, which may strengthen the state and citizen trust?
Thank you. Well, I mean, let me first just say that in terms of challenges, I guess there is different types of challenges. I will not talk about the economic challenges just because I'm not an economist, but I do know some that definitely, I mean, economies will be affected. I mean, the COVID-19 will trigger a sharp drop in household incomes in the area. So we are expecting also remittance, which represent around 40% of GDP in fragile countries in the region, might go to, or is expected to tremble by 20%. And other aspects that will affect the enterprise, the social economy, and mainly and globally the how we say, the daily life of population and the workforce. But I will let this issue because I don't want to get in something that requires more expertise. I'm much more concerned about some how we say, consequences, or let's say challenges related to the structure of each country. So actually we have like some priorities for each country, either political or economical or security oriented. In Algeria, just before the pandemic, they were facing, I mean, the anger of the street under the Hirak. Today, they are debating even in the parliament the reform of the constitution. Just the new coming president, there is a lot of issues around the governance, which I mean has accumulated a lot of lack of transparency during the last 15 years. And for sure, the new president, and he's trying to overcome some of these difficulties. But this is an issue not only of transparency, but also of trust. So without trust, even today, I mean, without trust and solidarity, we cannot, I mean, face any disease or any epidemics or any crisis. This is one of the issues. For others, I mean, it seems to be, if we take, for instance, the case of Libya, the Libyan case is much more security oriented, but there is some chances, despite of the fact that there is such risk. I guess Libya is also within the next coming 3 years, it could be a good market of reconstruction for big companies, and it could be one of the exits of reconnectivity, if we would like to be much more pragmatic. Morocco, which is an open market, which has a lot of course, to be open, it's a good thing, but also challenges are much more doubled. So he has to face, to deal with the social economy and to convert its opportunities for some weak economies, like the economy of services, maybe to reduce or to balance between real economy and interdependence opportunities. Tourism is a good example for Morocco and Tunisia. Today, they cannot recover quickly. It might take even 18 or more months. But I want to finish by, before talking about transparency and the management of the information, I want just to mention there is a big challenge today, is just not to hijack the crisis and to convert the crisis as a medical crisis. So the crisis is not medical at all. So this is something very, very important. So we should maybe dissociate health security and the medical security, which are completely different. And unfortunately, sometimes there is a lot of confusion around that. Because if we focus or if we medicalize the crisis, it means that we are satisfying those companies who would like to convert the African market to a market of drugs. I'm talking about not drugs, but I'm talking medical drugs. I mean to medicine, and the pharmaceutical industry is eyeing, I mean, this opportunity in Africa, and they're pushing even to keep us obsessed by the fact that this medical investment, medical industries, medical projects should continue. I guess this is very important. Maybe the efficient way is that not only North Africa, but all the continent should be much more associating health security to SDGs, Sustainable Development Goals. This is the efficient way to overcome the negative impact of COVID-19 on economies, on society. Maybe we need much more. And of course, when we are talking about transparency and talking about the medicalization, also there is a fear that public opinion in Africa do not hide, the fear that some governments will monitor the tools of fighting the virus and to convert it as a tool of governance, and to keep the army, to keep the police, to keep security procedures, to keep emergency of urgence on the street, mainly
we remember that in Africa in 2021, we're expecting more than 12 general and presidential election. So also this is another challenge which affect, the governance, affect, the transparency. Talking about the information is problematic not only in our continent or in North Africa. For sure, to share information is a huge debate today. It's a part of the rights people, but also, let's say it frankly, and I'm speaking as, well, I pretend as an expert in crisis management. Let me enjoy that title at least here. So talking about crisis management, sometimes information became, a strategic tool. We cannot share it at large. Of course, you should share what the population need, but you cannot provide everything when it has to do sometimes with because when we are talking about health, we are talking about industries, we are talking about license, we are talking about so many things that you cannot speak openly on all details. But what I agree is you cannot hide the epidemic situation on your population or on international community. This is something. Second part of the transparency, you cannot decide under the technicity skills. So whatever you are brilliant, you should go to respect the legal frameworks. This is a very important guarantee for our performance in the continent. And this is, I guess, my modest reaction to the question.
In light of all these information, Ambassador Lulishki, I'd like to have your say on what is the best approach or strategy for the African continent to best address and mitigate risks posed to the most vulnerable people in the continent, how to better mitigate the humanitarian impact of this crisis.
Well, let me begin by doing the same thing like my predecessors, talking about the challenges. I will divide this my presentation.
Ambassador, I would just like to inform you that we still have 8 minutes left in our discussion, which is quite unfortunate since we do have many information. So,
well, I will try to be as brief as possible, but I think that some element has to be added to the debate. Well, in terms of challenges, as far as the host states of refugees and IDPs are concerned, let's list just some of the challenges. The immediate challenge is how long for the states to keep the measures that they have taken, and how and when they will lift them progressively. Second one, will the population see it as coming back to normal life, free at last, or if the situation worsens, can the authorities come back to the situation ante without having any disturbance, for example, for the public order? States will be faced with the following challenges. First, conflict, instability, lack of infrastructure, particularly health infrastructures, humanitarian situation. According to the UN, 2020 is going to register the worst since the creation of the UN, the worst humanitarian situation. 250 million people might die from starvation by end of 2020. And finally, I come to the very important element, which is a lack of funding. The UN Secretary General called for $6.7 billions of dollars for Africa and for the other developing countries. Only 1.7 have been disbursed, not even the fifth of this amount. If you add to that some kind of fatigue by the donor countries and the shrinking foreign development, foreign direct investment, you will see the very huge challenges and the hurdles that the African countries have to overcome in order to deal with their with the aftermath